in different countries. And I think that we have fantastic internal medicine specialists and intensive care unit specialists. Indeed, Panama, even before, well, we try everything like I think most of the people at the beginning of the pandemic. Indeed, I have to tell you that the first 6 weeks were very difficult for us. Even though we have only 200 cases a day, basically we were very close to the collapse of the system. We built a hospital special for intensive care unit in two months, basically. The country invested for that. We started to use steroids very early, even before the data from the benefit of the steroids came out from England. Our specialists were using steroids in Panama. We intubate everybody, to tell you the truth, and I think that didn't work very well, because we learned later that you didn't need to intubate everybody. However, because we were able to flatten the curve, that gave us enough time to prepare for the worst, because we are now, like the US, for example, with a high increase of the cases. However, we still have a lot of capacity because we invested in buying significant number of ventilators. We got donations from many countries. The US, for example, have donated. China has donated a lot of ventilators. England has donated a lot of ventilators. I think that the solidarity, the international solidarity, has helped us in that regards. And I believe that because we have very small cities beyond Panama City, as I mentioned, 200,000 is the biggest cities besides Panama City, that is close to 2 million. Most of the people is concentrated, most of the cases are concentrated in highly specialized institutions. And because that, I think that has kept the fatality rate below 3%, that is the average in the region.
Yeah, thank you. My next question is to Dr. Peter Chang. Peter, I was struck by this compelling case you've made, that the work that you really dedicated your professional life to in the last decade or so is so critical to do before a crisis like this hits, right? You made a compelling case that in the midst of the crisis, misinformation, even the data about that we saw earlier about people's suspicion about the vaccine is really hurting us. So I wonder how you, what you would recommend in terms of, in the midst of this crisis, what can we as countries, nations do, and more importantly, since we also have providers here, researchers here, what can we do in the immediate, in the midst of this COVID crisis to address this high level of health illiteracy? And more importantly, what can we do long-term to ensure that the next pandemic, and everybody's predicting there'll be another pandemic, what can we do now that we've seen how harmful it is not to have health literacy, to make sure that we're better prepared for the next pandemic?
Well, thank you, Joyce. This is apparently very tough questions I can receive from you. Well, the example Taiwan can share is that actually we learned a lot from the last pandemic, the SARS, and we got a big casualty in 2003, and that making a lot of change in our health regulations. And also we are giving a big power to the health command center that centralize information sharing, because you know, misinformation is totally very difficult to control. So the law giving the command center is important that you have to systemically organize all the data and sharing the data, and transparency and then timely information is very, very much important, but also trust of the health authority. I don't mean authority, single authority, means that the health expertise in this regard is very important, particularly in the pandemic, because now we are in social media, we are in the ICT, where everybody has their own radio, you know, they have a way to transmit it. So I think the misinformation is something we have to think about how to give it to the But that's important for people to get the information. But on the other hand, we have a lot of misinformation. They will come out immediately with this freedom of the sharing of information. So I see that part of this is a health literacy in every individuals that they have to see. Health is one of the important part of the daily life. It's important part of the economy. And the pandemic was extremely example of testing for all individuals in the society sharing this social media technology. So I see that all the scientists are good in all the country, but on the other hand, there are differences in terms of how to deal with the misinformation. And with too much misinformation, health literacy will not really grow, and then people will be misguided, will got the wrong information, and really jeopardize all the health effort.
Excellent. So the next question, and I think this is going to have to be our final question to both of you, is as a result of the COVID-19 pandemic has revealed, I would imagine that both of you agree that international collaboration is more important than ever. Both of you had included in your presentations the importance of actually getting research data across the globe as we think about a global approach to this. I wonder if you could speak specifically to what the bright side of this pandemic and what opportunities it's basically revealed for us to really leverage international collaboration around research, around education, and really around having a not only regional, but also a global strategy the next time we have another pandemic like this. Eduardo?
Yeah, thank you, Joyce, for the question. To tell you the truth, collaboration is something that I learned during my experience in the US. It's contradictory, but when you come to countries with limited resources, the willingness to collaborate between investigators and institutions in the country is not there. This is something that we have to work and invest in particular in Panama, where I am working right now. Of course, I am trying to copy some of the good things that I learned at Tufts University and also in California to implement it in Panama. And to tell you the truth, during the peak of the pandemic, for example, we wanted to run serology studies in Panama, and it was very difficult to get access to some of the samples because they were controlled by some institutions. Indeed, I wrote to Florian Kramer in New York, for example, and he sent me immediately his recombinant protein and his vector for me to produce the recombinant in protein to implement an ELISA test in Panama. Then a local collaboration is something that we have to work very strongly. In the region also, to tell you the truth, for example, we are 7 countries in Central America, and we are each one of us working independently. We are not collaborating between ourselves. We are doing our own strategy, our own access strategy, our own serology studies, our own everything. I am working with Marilena Botassi from Baylor College, for example, right now to try to establish a network of investigators in the region and scientists to try to go in a different direction. You know, we have to strengthen and prepare ourselves for the next pandemic, as you mentioned. But there is a lot of work to do. To tell you the truth, it's easier for me to collaborate with institutions in the US and Europe that collaborate within the country. Then one of the first things that I would like to do, starting in January, is to build that collaboration between institutions, and because I will have access to the investment and money from the government, I will have to somehow push them that if they don't collaborate, the money will not be there for them. Then I hope that, with the help of some of you in the US and the guidance of people with experience that you have in R&D, we will like to implement good ways of working for our country. But it's a challenge, but I think that we will get in there, and we will establish new ways of working within the country.
Thank you. Peter, your final comments from you?
Yeah, I think the international collaboration is so much, and it's based on quite a few elements. Transparency and effective and then timely sharing. I think this is take quite a lot of exercise You know, we build up all these cables around the world that we can share it, but usually we don't share the health information very much between people. And I tend to say that men tends to be low in health literacy than women because they are not used to sharing the health information between, you know, themselves. So I think that importantly that we have to learn, we have to use the tool we have and start to making best use of the tool. We have to sharing, and a better communication is also needed. You know, sometimes it's just not a lesson, it's not a teach, it's a communication step by step from different individual, from different social ingredient. So I think that the international collaboration is essential, and we are still in the early stage of fully using the capacity, the hardware we have. And this is something we have to learn.
Yeah. Well, thank you so much. And I want to invite our audience to thank these two distinguished speakers for this discussion. We have now an inkling into what is happening in Taiwan and Panama, and this has been tremendously informative. Thank you both. And I want to again thank you for your support of the students at Tufts. And Peter, you've hosted them, you've mentored them, and Eduardo, I will come knocking on the door and take you up on your offer to host students in Panama as well. Thank you. Thank you everybody for joining us. Thank you.
Thank you very much.
Thank you.
Thank you. I'll hand things over now to, is it Caroline?
I think it's Laura.
Okay, to Laura.
Hi, everybody. Thank you for those fantastic talks. My name is Laura Portland. I'm an assistant professor of public health and community medicine. I'll be the moderator for this next session of Lightning Talks, where we will examine how people's position shapes experience and access to essential economic, medical, technological, and religious structures. We'll get to hear from a diversity of disciplinary perspectives to help us come to grips with how the pervasive impact of the pandemic. We'll start first with Felipe Diaz, PhD, Assistant Professor of Sociology at Tufts University, who will discuss the motherhood policy and the fatherhood premium in employment during COVID-19. Next, we'll hear from Susan Landau, PhD and Bridge Professor of Cybersecurity and Policy in Fletcher School and the School of Engineering. She'll discuss contact tracing apps in public health. Then Tamara Vessel, MD and Chief of Division of Palliative Care in the Department of Medicine at Tufts Medical Center, will tell us about changes in utilization and perceptions of palliative care among physicians and hospital leadership at Tufts Medical Center and community spiritual and religious leaders during the COVID-19 pandemic. We'll conclude with some questions, and we hope that you'll submit questions in the Q&A box on your screen. Thank you.
All right, so I'll go ahead and start. Let me share my screen. Let's see. Sorry, I have the wrong one. PowerPoint slides. Okay, great. So thank you so much for the opportunity to be here. Can you guys see my PowerPoint slides? Okay, all right, great. Let me put in presenter view so you can see. So yeah, so this is part of a larger research agenda that I'm currently working on the effects of the COVID-19 pandemics on a range of socio-economic outcomes. So today I'm going to be talking about this project, the mother penalty and the father premium in employment during the COVID-19 outbreak. And the project was recently published in Research in Social Stratification and Mobility, and that's co-authored with Joseph Chance and Ariana Buchanan. Joe is a PhD student at the Fletcher School, and Ariana is an undergrad at Duke, who was a fellow, a Verse Fellow this past summer here at Tufts. So in this project, present evidence from the Career Population Survey, examining the effects of the COVID-19 crisis on parental status and gender inequalities in employment in the United States. There are reasons to believe that during the economic downturns in general, employers may deploy various forms of gender-based stereotypes associated with parental status, as they're forced to temporarily scale down businesses' operations, cut costs by reducing wages, reducing working hours, laying off workers, And we know from gender scholars that based on cultural beliefs of mothers as expressive caretakers and fathers as active breadwinners, and therefore deserving of career advancement, we hypothesized at the beginning of the study that cultural beliefs, these cultural beliefs may have shaped employers' decisions during the post-outbreak period. Again, the data comes from the current population survey, the rounds from 2019, December through May 2019. This data can be accessed through the US Census and US Bureau of Labor Statistics. So what I'm presenting here are general patterns and employment changes